Well, good morning and welcome. We're very excited to have you join us today in this new year, 2023. We were just talking about how difficult it is to get used to it being 2023, but it is. And
Yes.
we want to welcome Clarissa Cerda. Good morning, Clarissa.
Good morning. Thank you so much for having me this morning.
How are you doing?
I'm doing well. Thank you. Happy New Year.
Happy New Year. Clarissa is the Director for Rehabilitation Nursing Services at DHR, and she came and spoke to some middle school students, and I just liked her story so much. I wanted to make sure that we got to talk to her more because I didn't feel like I had time to ask her questions then, so I'm going to ask you questions now.
Great. Thank you.
So Clarissa, first of all, I want to welcome students who are coming in and joining us. I want to remind you that this is recorded and that you can watch it on YouTube later if you have questions. In a little while, I'll be opening the chat and you can put your questions there. Also, we'll unmute you in a little while if you have questions. So Clarissa, tell us first of all a little bit about yourself.
Yes, ma'am. So I'm Clarissa Cerda. I have been a nurse since 2012, and since then have been employed with DHR Health actually in 2012. So ever since I've been with DHR Health, I believe it's been one of the best decisions that I've made, and I've really enjoyed my nursing career up to now.
Oh, that's great. And tell us a little bit, I'll tell you what students want to know is,
Perfect.
What did you do in high school? Like, did you know you wanted to be a nurse? Were you preparing to be a nurse? Did you not know what you wanted to do? Like, tell us a little bit about like when you were in high school, what you did and what were your thoughts then?
Perfect. So when I was in high school, I would say I had a very good idea that I wanted to become a nurse. There was one other career route that I would have taken was to be a pre-K school teacher. But I had an idea that healthcare is where I wanted to be at a young age. So in high school, as a freshman at that time, back then, we were barely getting the Gear Up program to come into the schools.
Yes.
So our senior class was selected. I believe they came in sophomore year. So opportunities that I had at that point in high school that I took advantage of was starting a medical terminology course. So we had that offered to us, and I believe I enrolled in that sophomore year. So that kind of gave me an idea of this is an idea of what healthcare is. It gave me an opportunity to take advantage of that, learn a little bit as we went. We had HOSA back then where we had an instructor. I believe she was a nurse as well. So she spoke a lot to us about what that looked like at that time, the opportunities that were available. And we were able with our medical terminology class to go to a local nursing home. It was a tie-in between those instructors had a contract or whatnot with the local nursing home, and we went there. Were able to spend a Saturday afternoon, and I think that kind of gave me a preview to what it would look like if I wanted to become a nurse. So those were the opportunities then that were available, and we definitely, I believe, they helped me steer me towards the healthcare career route.
Well, I think that's great that you had an idea that you wanted to do that. So what led you to that idea? Was it something that happened in your life, or did you do some type of like career inventory, or what led you so early to know that you probably wanted to do that?
Yes, and I remember I was about 10 years old. You know, in our Hispanic family, we're very close. Our grandparents are the backbone of our family. So it was a typical, you know, every weekend we were with our grandparents. We lived across the street. So when I was about 10 years old, my grandfather suffered a rattlesnake bite to the lower extremity. And you're looking at a man that to me, he was my Superman. So being able to, or being in a situation where he was really weak, not able to do for himself what he's so used to doing, I believe took a big toll on him. And even though I was just 10 years old, my mother is the eldest daughter of the family. So she volunteered to learn about the wound care, how to clean the wound, how to dress the wound, about the ointments, the packing of it. And I just wanted to be with her. I was everywhere with her. I wanted to be the nurse. You know, she'd call me her little assistant. And I thought it was the coolest thing. What now I know we refer to as gauze. I thought they were paper towels that we were cleaning it with and applying the ointment, and being able to see the wound of how the big incision to progressing into so small that we no longer have to do it twice a day. So I just remember seeing that and thinking how we helped him, and in the spirits, right? We try to help someone. No one wants to be in a hospital. No one wants to require somebody's assistance for being so independent. We don't want to be in a situation where we need somebody. So being able to help him in my own little way as a 10-year-old and seeing him get back to his normal routine on a daily basis, I think was the most rewarding part that kind of put me to that, like, oh, I want to do this for everyone. You know, I liked the way that felt, and being able to see someone so strong at his weakest moment to back to where he needed to be was just inspiring to me.
That's very exciting. And I'm really excited to hear you say that you were part of Gear Up when you were in high school, because we're here today because of the PATHS Project and our partnership with DHR, but we're sister grants in our office with the other Gear Up. So some of us work for both PATHS and Gear Up. And so we're always excited. As soon as we hear Gear Up, our ears perk up. I know that some of our students who are listening are Gear Up students and also PATHS students. So that's really exciting.
Yeah, that's perfect. And I want to thank you all for all those opportunities, because I can imagine how much they've developed over the last 15 years. So I'm so excited that our community here in the Valley gets to experience that, because I can imagine the endless opportunities you provide to them. So thank you.
I'll tell you, it's a very exciting thing to know that the opportunities afforded to students. And here at Region 1, I'm really excited that I get to be a part of that. So thank you for bringing them up, because there are students out there that are the same, that are Gear Up also. So you know what you want to do. You graduate from high school. It's very exciting. You had a lot of options. There's a lot of places that you can go to go into nursing. So what did you do?
Yeah, so with all the options that we had available, I had the mindset of, I want to leave the Valley. I want to go experience something else. So I did. I applied to several universities, but I opted to relocate to East Texas, to UT Tyler. I went over there and started my prerequisites because the Gear Up program offered me an opportunity to do dual enrollment during high school. I completed the rest of my prereqs those first 2 semesters, and I was ready to then apply to nursing school. And like you mentioned, we have so many different options. So if you think, oh, I want to, go excuse me, out of the Valley, you can do that. But now the great thing is the programs and the universities that we have here in the Valley is also great to have. But from my experience, I did opt to attend UT Tyler, 10 hours away from home. So you can do it. There's some of us that in high school, we think I want to do this, but no, I can't. And I won't be able to. Yes, you can. You apply, see how it goes, take advantage of all the counselors that we have, to help us, instructors, professors, teachers, and you can do anything that we'd want to. But for my experience, I did go over there for 1 semester. Due to everyday life or personal things that happen in family. For my experience, my parents went ahead and decided to get a divorce, but I decided that wasn't going to affect me, right? Because we get to decide. It is a hardship. No one wants to see that. But I took it to, okay, this isn't going to stop me. I will then just instead go closer to home to be available to my mother, and I have 2 younger brothers. So that's what I did. I didn't let it stop me. I just came a little closer to home, and I transferred my credits, which is possible, and there's counselors to help you do that, from one university to the next. And I actually transferred to Texas A&M in Corpus Christi. Oh, okay. And that's where I went ahead and attended nursing school and graduated from there.
Oh, that's great. So tell us a little bit about going to college, because you did something that
Mhm.
A lot of Valley kids want to do. They want to get out of the Valley and
Mhm.
live either in another part of Texas or another part of the United States. So tell us a little bit about going away. What are some of the things that you faced, both positive and maybe some challenges
Mhm.
that you faced living away from home?
So definitely, I took advantage of all the opportunities, resources for room and board. I think that's the biggest
Right,
one we face. And being a high school senior, living with my parents to then living on your own, I think was the biggest adjustment.
right.
We say we're really excited to do it, but once we do it, it's definitely an adjustment that's needed. But I think the biggest challenge was just getting used to that, being, as far away from family. I mean, even at another city, you're far away because you're so used to, you're in the
Right.
same, under the same roof. So the biggest challenge for me was getting accustomed to being 10 hours away from home. The only one there. I don't know what I was thinking. Didn't go with a classmate or anything. I just was there. And another adjustment is just getting used to your surroundings and the different people you'll get to meet. It's
Right.
also one of the most interesting factors, but it's also the most intimidating because you're so used to being around, your friends, your peers for the last 17, 18 years, and then you go somewhere where you feel you're brand new and you get to meet different people from different cultures, different beliefs, different backgrounds, and my best advice is just take a hold of that, get to
Yeah.
know everyone and the different cultures and practices that everybody does and their experiences, different languages. You meet people from all over the world, and
Mhm.
it's a very good opportunity. But the biggest obstacle is that just being away from family and learning how to live on my own. No one was going to wake me up for school. I had to go put on an alarm, get to school when I needed to. No one's going to force you to classes. So having that commitment of I'm here, I want to make the best of it, and I will be successful.
Well, tell us about the coursework then, because we've talked to many, many different careers in healthcare, but we haven't really talked about nursing. And I know how challenging it is. I know students have been told how challenging it is. So can you talk a little bit about the coursework that you had in your nursing program? And was it a
Absolutely.
nursing program? What program were you in?
Okay, so absolutely. So when I was ready after my prereqs, the nice thing about nursing is your prerequisites. So your anatomy 1, your anatomy 2, your microbiology. A lot of those courses are the same coursework foundation that you need for any avenue of nursing that you take. For
Right.
example, if you're going to apply for a nursing program that offers an associate's degree with compared to a nursing program that offers your bachelor's degree, a
Mhm.
lot of the foundation courses are the same. The same thing for now the LVN programs. A lot of
Right.
them are the same. So there's different avenues to become a nurse. None of them are better than the other. It's just more opportunities that we have.
Right.
But I think that's neat because the coursework will be the same. The prerequisites are the same. So that way it gives us an advantage to, I can complete my coursework, my prerequisites, and then guess what? Instead of just having one option, I get to apply to 3 different degree nursing programs, and then I just increase my chances of getting accepted.
Yes.
And there is no right way. The great thing now is the bridging of programs. I can first get my LVN, then become an RN, go associates, bachelor's, whatever I want to do. So
Right.
that coursework was the same. And it is difficult. I like to share that, just to have the commitment that if nursing is really what you want to do, anything is possible as long as we have that commitment of, I may miss out on some weekend getaways. I might miss out on a night out on town or whatnot, but
Mhm.
just knowing that the investment in that degree is worth it, right? You're going to just get through. It's a tough 2-year prerequisites. I'm sorry, for my experience, I went to a BSN program for my bachelor's degree. So it was 2 years of prereqs and then a 2-year nursing program. All
Okay.
nursing programs for your associate's degree, your bachelor's degree is, most of them are 2 years. Now there's also accelerated programs. So anything is possible, but the coursework, it is demanding. You will have to study, you'll have to learn, but it's not impossible.
Right.
You hear that all the time. Oh, it's so hard to get in and they only accept this amount of students. Yes, that's correct, but there's so many programs. You can apply to so many at one time and it just increases your chances to get in.
Well, you brought up a very good point. So what can someone in high school do to make themselves a good candidate for a nursing program? Is there anything that they should be doing now?
You want to, or my recommendation would be to get experience volunteer hours in different local, like nursing homes or anything in our local community that we can volunteer. I know DHR Health has volunteer services where you come and register to be a volunteer and help in different units at different capabilities, right, capacities. But I would recommend doing something like that just so you get a preview of what healthcare is, and if that's something that you'd like, any courses that the programs offer, and just speaking to different healthcare professionals so you can get an idea of this is what you want. But I do know that when they review your application, something that always sends our volunteer hours in the related field. Like if you want to go shadow someone at a facility, will always look good on the application.
Okay, that's great. Thanks for that advice. So you finish your program, and then how do you go from college to being a nurse? Like, you hear about licensure. So can you talk a little bit about that?
Yeah, so once you complete your degree and pass your exit HESI and you walk across that stage, best feeling in the world, by the way. But after that, it is a, excuse me, it's a self-paced study time that you want to take. A lot of different students decide, to wait a certain amount of time before they test or apply to take their licensing exam. So for nursing, that exam we refer to as NCLEX. So once you finish school, depending on how prepared you feel that you are, you can schedule that exam as soon as you want. You get a permit that's a graduate nurse permit that every graduating nurse gets. And once you're issued the GN permit, then that allows you to go ahead and schedule your exam. You get to schedule, like I said, whenever you'd like. If you just want to take a month off to study and prepare for the licensing exam, you can, unless you want to do it the very next day as soon as you get the GN permit. So those are the steps. You graduate, you're issued a GN license number, and then you can register for the NCLEX as soon as you'd like to.
So then after that, you pass your exams, woo,
yes.
And you want to go look for a job. And I know as a non-healthcare professional that nurses are everywhere. Nurses are in school, they're in doctor's offices, they're in hospitals, they're everywhere. So what are some of your choices as far as a career when you go into nursing? And then tell us a little bit about the decisions you made to get where you are.
So anything you'd like, we go into most of the time in nursing, all nursing schools, you'll have different rotations, different courses. So you'll be able, before you graduate, you're able to go do a rotation, a clinical rotation in women's health. You do another one in medical surgical services, in hospice, all kinds of things. So you kind of get an idea of what every field looks like during nursing school. When you graduate, so that might lead you to have an idea of, oh, this is the specialty I want to go into. I want to be an ICU nurse, for example. Then all those opportunities are at your fingertips. You look up RN jobs or nursing jobs, and all of them will come out, and you decide exactly what is it that you want to do. A lot of times we graduate and we all want to go into the ICU, the intensive care units, or we want to go to the emergency rooms. Or sometimes we're told, no, do medical surgical services first, because then you get an idea of all your nursing skills. I want to learn how to start IVs and insert Foley catheters and all of that stuff before you go into a specialty. So anything that you'd like to do is available. Like you mentioned, school nursing is available. Remote nursing is very big right now. Travel assignments. A lot of people think that the travel assignments came just once we suffered this pandemic. That's when everyone started traveling, but truth is they've always existed. They always get contract work, and you kind of get to go do different nursing in all kinds of hospitals. So when I graduated nursing school, I actually thought I wanted to be a behavioral health nurse. That rotation, I did it with the adolescent unit, and I just thought this is where I want to be. But when I actually, you know, the one, remember, that said I want to move out from the Valley, I came back to the Valley as soon as I graduated. So I'm back at home in, you know, Rio Grande City. I'm at my mom's, and it's time. I passed my NCLEX, and I'm like, okay, what do I want to do? So I went ahead and started looking up jobs, and I really thought there wasn't too many behavioral healths at that time. So then I opted for medical surgical services. So that's a nursing floor where you see all kinds of patients who are here that need surgical procedures, whether it be, you know, removal of their gallbladder, or they were in a car accident and, you know, they had hip surgery or different things like that. So I applied to the three hospitals that were in the Valley at that time, and was interviewed in all of the hospitals. Was given a job offer on all three. But at DHR Health at that time, they were doing what we call a residency program, which we have available today, where you get to apply to the program, and the program will follow you for the first 2 years, depending on which service line you want to do. So for example, if I wanted to become a rehab nurse, I am with the program for 1 year, and I get to start in this unit and start seeing everything. At the same time, I'm going to different courses and different departments to gain other experience, and then I'm released to my unit. When I was looking for a job, I decided to apply, or I interviewed at the rehabilitation hospital in 2012, and my director, it was a really good interview. I liked exactly what she said and how she explained rehab. So that's where I decided to join. Although I had different options, I think I was sold on the part where you see a patient that, you know, unfortunately suffered a stroke. They come into our rehab hospital after our main acute care hospital units have taken care of them. They're ready to continue with their recovery process, and they opt to come to the rehab hospital before going home. So at the rehab hospital, our job was to make sure to give them as many resources as they needed to successfully go home. And how do I play a part of that as a nurse? Well, I work closely with different disciplinary teams, in this case, physical therapy, occupational therapy, and speech services, where we all have the main goal with our rehab doctor that we want to get them home. So as a nurse, my job is to make sure to answer any questions that they have, educate them on the medications, why it's important to take them, how can they prevent having another stroke, and with the family, being there for the family to let them know, no, we're going to give you the tools that you need to care for them at home, and for the patient themselves not to feel like a burden, right? Because again, someone who's so strong, unfortunately, this happened to them. Now, how can I get you to as close as possible to what you used to be before your injury? Mm-hmm. So that's, I think, the idea that sold me on it, that I said, no, I want to be part of this team. And as soon as I started, you know, the orientation process as a new nurse, sometimes that's scary. You're thinking, well, what are they going to do to me? I just graduated school. I'm not ready to take care of patients yet. But you learn a lot once you're already here. And any organization, any unit will give you an orientation process program that will help you. So as a new grad, for the most part, you get a 12-week orientation. So as soon as I started orienting, you see the patients. That one patient I met on the first night of admission, I admitted that patient. 2 weeks later, I see that same patient. They look like a completely different person. And that is just what was rewarding in this specialty, that I was like, nope, this is where I'm staying. So, and I did. The first 3 years I did night shift, which my recommendation to any new nurse would be start night shift. I know we think like, I don't want to work graveyard, but I think the best opportunity is then, just so that way you have an advantage in the sense of learning how to navigate the electronic medical record, be able to read the progress notes of different physicians and specialists. So you kind of understand the background of the patient, and you get to see their progression. So for me, I feel like that's the best decision. I did work there for 3 years. Then by the time I knew it, I was engaged to be married. So I moved to the day shift, and my coworkers at that time, they were my family away from home. And they said, no, as a newlywed, I would recommend you work day shift. And I was like, okay. So I was so used to being a night owl. Like that's where I thought I was best. So I went ahead and transitioned to day shift, and that was a different a different environment, if you will, because then that's when you work with the multidisciplinary team. That's when everyone is in the hospital, like the therapists are working at that time, the physicians, all physicians around mostly during the day. So that was an adjustment, but it was a great one. The time flew by a lot faster. You were busy and you got to see a different aspect of the workflow and everyone working together. And like I said, the opportunities are endless, because after about 1.5 years of doing day shift, different opportunities came about in leadership positions here at the rehab hospital. So I took a leap of faith and I applied to become a rehab ortho manager. And I liked that role because what my responsibilities were is to make sure that what I was doing as a bedside nurse and following physician orders and educating the patients and their family and staying in compliance with the documentation and everything. Now in this role, I was responsible for making sure that my colleagues, which, my former colleagues were now doing. And I liked it, believe it or not. I would have never guessed I would have come into the administration side of nursing, but I enjoyed it because I felt like I can still make a difference, because if they needed help or they fell short on documentation or whatnot, I was a resource that I could still go help.
You could still, yeah.
So that was nice.
That's great. Well, I want to remind the people who are listening to our cyber mentoring today that you can go to the chat and put a question there, and I can ask Clarissa that question. So Anita Barrera is asking, do you hesitate to call doctors on night shift? Like when you're on night shift and you need to call a doctor at 2 o'clock in the morning, do you hesitate to do that?
That's a great question. I think initially I really did, because you want to make sure that if you're calling that physician at 2 a.m., that it's because I need something. So to be very honest, yes, it was very hesitant. I think one of the biggest adjustments in nursing is getting comfortable speaking to physicians and other roles like that, especially the doctors. But at night, what we try to do is when you get report at change of shift, it's about 7:15 in the evening. I kind of already had an idea what my patients needed, what was critical on this patient, what were my follow-ups. So you have an idea, you flag those, and then you follow up on it. Like an example is if that patient is having uncontrolled high blood pressure, and the nurse during the day is telling me I just gave them a medication. I knew that I had to look at that. If that blood pressure was still going to be dangerously high or abnormal, then we call the doctors. And the doctors are, they know that if we're calling, it's because we need an order or an intervention ordered for our patient. So it is at the beginning scary, but it's fine. Always remember, if I'm going to call a doctor and it's to better serve and advocate for my patient, then it's completely okay.
Yes. And I'm sure doctors expect to get those phone calls.
Yeah, and now you're right about that, because they also do what we do. Some of them do day shift and others do night shift. So there's a designated on-call night shift doctor.
Oh, that's good. That's good. I want to go back to something you had mentioned earlier, because I think it's very interesting that you talk about being on a team and teamwork, because as educators, we tell students all the time, we're going to have you do this project on a team, because when you get on a job, you have to be on a team. And some students want to, and some students don't. But I see that connection to when you were a little girl, you and your mom were a team helping your grandpa. So can you talk a little bit about the importance of teamwork where you are?
Absolutely. So teamwork is really important. I know for us, initially, I don't think I ever wanted to work in a team, but when I was younger, I think, no, I'm shy, or I don't want to work in a team. I'd rather do the work alone.
Myself, right?
Yes, exactly. And then you also think of the potential of having a mix of personalities that you just don't see. It's not easy to do it. But, it is very important. And I think the more practice that we get, starting in high school or anything, is going to be a big benefit, because you learn how to interact with different individuals with different thought processes. And sometimes I'm guilty of this myself. I think, no, I have the best idea. But when working with a team, then you hear everyone out and you realize, oh, that's a better idea. So working in a team is really important as long as we have the same common goal to reach.
Mhm.
Nothing can steer us the wrong way. So I think that's a great idea of having those exercises and working with a team, because you learn how to communicate with different individuals, tougher personalities, and you learn from people, because sometimes they think of things a different way, that will teach me that next time that I'm in that position, like maybe this would be my recommendation instead of that one. So
Right.
working with the team is really important.
That's good. Also, what are some challenges that you face as a nurse? What are some things that are very difficult to overcome in your everyday job?
So some challenges when as a bedside nurse were, when I was trying my best, I wanted to do my best for my patients, and I felt like I was doing everything I needed. Sometimes the patients are a little bit more upset than we'd like them to be.
Yes.
So something that was challenging was understanding, having that empathy of like, oh, I understand why you're being like this. I did nothing wrong as a nurse, but you're upset, not necessarily at me, but because of the situation.
Right.
So that was a big challenge for me, is not taking it personally, putting myself, having that compassion, putting myself in their position, thinking, okay, you're just frustrated because you're here and not home. So that was the biggest part of it. And I think that once you conquer that as a nurse, then you'll be completely okay. You'll know, like, okay, as long as I did my best, I got you the medications that you need. I spoke to the physician about any questions that you had. It's okay. Patients are going to have bad days.
Right.
And I'm, as a nurse, I want to be here to just get you through those tough times as best as I can and advocate for you as much as I can. Challenges that our staff or nurses face today would be, which it's nationwide, I believe, staffing shortages, finding the nurses that are needed to take care of the patients. So maybe I'm used to having 5 patients and today I have 6,
Yes.
or a 7th patient. I think that adjustment after the pandemic was one of the biggest challenges that we faced, but always just having that mindset, providing safe patient care, and working as a team with the rest of our nurses. So that way, if I'm stuck on one patient and need assistance, I know that the 5 other nurses that are working with me, one of them is going to come and help me.
Well, that's great. So tell us a little bit then, because you are in rehabilitation services, what is a typical day for a nurse that's in rehabilitation services? What are you going to do? I know you said you had night shift and day shift, but I don't really think the day-to-day tasks are that much different. So what, or are they?
Yeah, they're not too much different. So a day in the rehab nursing, you get here, let's say we all work 12-hour shifts, right? In nursing across the board, most hospitals. And so when I get here, the first thing I'm going to do is get report from the off-going nurse. So if I get here, I see my assignment, I see the 6 patients that I'm going to have, and then I go room to room with the night shift nurse. So that way she's signing off and I'm coming on. So we go give report at bedside. I introduce myself to the patient, so that way they know, he or she may know that I'm going to be the nurse for the next 12 hours. And the nurse is on her way out and she'll be back the following night.
Right.
So we introduce ourselves. Then once we've met all our patients, we let them know we're going to pull their ordered medications and we'll come back to see them. Please call me if you have any questions before then. And then I've already introduced myself, or I know who my certified nursing assistant is. So I kind of touch base with her and let her know, or he or she know, like, these are our patients. I need so-and-so said they needed this, or this is priority. You kind of prioritize who you're going to see versus what you need to do. And while that's happening, the patients are getting ready with the assistance of the nursing assistant to get them up and ready to go to the dining room for their breakfast. So at that point, I'm pulling all medications that are ordered for the patient. So each patient will have, they're on different medications for different reasons and different scheduled times. So I'm pulling the meds for their breakfast, and while I'm doing that, I'm reviewing lab values. The doctors usually will order labs to check, different levels, their potassium level, how, their WBCs, different things that they want to monitor due to their disease process.
Right.
So at that point, when I'm coming in at 7:15, those results are already available. So I make sure to review those labs for each patient as I pull the medication, because that will tell me, is there an abnormal finding that I need to report to the doctor? Is everything within normal limits? So that gives me an idea, and that starts my day, because most of the time there's something I need to report to the doctor. So we do that, labs and medications, and then we start our day with going and administering the meds. We round on our patients every other hour. As if I do the even numbers, my CNA will do the odds, and we're checking on the patients routinely, asking any questions that they may have. A lot of them have different wound care orders. So then I schedule that within their day. I'll look at their therapy schedule for the day, and I know, okay, they have a break from 11 to 11:30. That's when I'll go do my head to toe assessment.
Right.
I'll, do the wound care. And then if family's at bedside, now I'm so happy that family are allowed back into the hospital. So answering any questions that they may have, and working with the social worker on discharge planning at the same time of doing all these other things. Because you may have 6 patients and one of them is due to go home. So then I know that in the morning I need to speak to the social worker and ask them, is everything in order? Do I need to call report to a home health nurse, or are they going to a facility that I need to fax over paperwork to? So definitely keeps you busy and on your toes, but it's great.
Yes. I tell you what I think is very interesting, and we've talked about this a couple times, but not with a nurse. So and I think this is the hardest thing, well, one of the hardest things for students to understand. So you say you work a 12-hour shift. Most kids think about an 8-hour job being hard, and, difficult. So tell us about having to work 12 hours. And I can tell you, my son's a paramedic. I know he works 24-hour shifts or 36-hour shifts. So tell us a little bit about working for such a long time period, because I think nobody's asked it, but I always know when we start talking about shifts, that's what students have questions about.
It definitely sounds intimidating. You're like, 12 hours, that's a long time, especially whether you work days or nights. It is a long shift, but what comes with that also is you meet your full-time hours a lot quicker. So you don't work, Monday through Friday. You work 3 hours a week, 1 week, and 4 the next. So you do have several days off during the week. But during the 12-hour shift, I think what gets us through the day is the pace of the unit. We keep ourselves busy with different orders and interactions that we have with multiple people during the shift. So you do get your lunch break. You can take that whatever time you'd like. So that's a 30-minute lunch break that we get to have. So if I start, usually what I would do is, as soon as I felt like that downtime, like I need a break, that's when I would take my break. But it passes by a lot faster than it sounds. I know that 12 hours is like, oh, that's half a day, but you definitely will keep busy.
So the other thing, and you mentioned it, is you don't work 5 days a week, 12 hours.
No.
You work maybe 3 days 1 week, 4 days the next.
Exactly.
So you actually get more time off.
A lot of days off. And I think that was an adjustment as a new nurse. I'm like, I get to be off on a random Monday. Like, okay. So learning to be able to do everything. It's a good schedule to have, because I know that, we may have doctor's appointments, or if I want to schedule some TLC appointments, like, massage or whatnot, you already know your schedule. Your director, your manager would already put out, most of the nursing units do a 6-week schedule. So you'll already know what blocked schedule you're on. You work every other weekend, so you'll know which weekend you're off for the next 6 weeks. So that was also another nice thing to know, because I was able to schedule everything else around my schedule. I didn't have to miss out on anything. If my mom wanted me to go to an appointment with her, I knew what days I was off, so we would just schedule around my work schedule.
That's good. Oh, great. So can you tell us about advances in nursing and what you see coming in the future? Because most of the participants listening right now are in high school, so they'll probably be on the job in, let's say, 4 to 6 years. So what do you see coming in the future?
So I think a lot of continued remote opportunities are coming. I think, of course, bedside nursing is always an opportunity, perfect job security. So I think with nursing in the future will continue to be needed in all different environments of the work setting. I think the opportunities are truly endless. I know in other careers too, but in nursing, anything that you want to do will be there. If you don't want to set foot in a hospital, you don't have to. You can still be a nurse and not set foot in a hospital. If the hospital setting is what you want to do, there's countless of different specialties that you can do. If you want to do home health nursing, that's still going to be around and available. Like I mentioned, remote nursing, you can do case management through a remote setting where you work from home. If you don't want to work from home, you can go anywhere. If you say, you know, I want to try this hospital, get a couple of years of experience, and then you want to travel, you can travel. So in the next 4 to 6 years, I feel like all of those opportunities will still be there, and then some, I believe. So I'm excited to see what else comes, because the good thing is you will always be needed as a nurse.
Yes. Great job security.
Yes.
Great job security. So tell me something like a positive part, like what's the best thing about your job? What's your favorite part of your job?
I think working directly with the patients, my best part of the job was having them say, thank you. Smiling, because something simple, you might think like what, but honestly, what you see that they go through and the tough times that you may have, there's also really good times to celebrate. Having someone genuinely say thank you for what you did means the world. And sometimes a lot of times it's also the family, which is great. And as a nurse, I think that was the best part, because even they trusted me to be part of their loved one's life when they were at home resting, getting the help that they needed, like the rest that they needed. They entrusted in us their family members. So to be able to get a thank you from a family member was also so rewarding, because they could see the difference that a whole team did, but knowing and being thanked for the little part that you played, whether it be I was a nurse for a whole week or I was a nurse just a shift, like for that family member or that patient to remember your name, right? I would have them one day, and then a few days later I'd see them, and although I wasn't assigned to that patient, for them to say, hi, Clarissa, or something like that, you felt like you made that impact, you know, enough for them to remember you. And they're not always going to remember your name. And in anything that we do, it's a quote, I believe, that they say, they may not remember your name, but they'll remember how you made them feel. And I think that was the best part. And on the administration aspect, now that I'm in this side, I think the most important part for me is also seeing the outcomes of the patients. And you know that you help operate an efficient unit to where patients are still having the best outcomes that they truly can. And we praise our staff for that every opportunity that we get, because it's not easy, and they do it, and it's great outcomes. So that's the most exciting part.
I'm glad to hear that. I want to remind those of you who are here live with us that you can put any questions that you have into the chat, and we'll relay those to Clarissa. So as we're wrapping up, Clarissa, what's the best advice you can give to students who are listening live or recorded if they're considering becoming a nurse? What's your best advice for them?
My best advice is you can definitely do it. Take advantage of every opportunity that you have in school right now. Talk to your healthcare professors, talk to your counselors, and ask them for assistance to connecting you with different community programs that we have, or services, facilities. I know almost every facility or organization is always looking for volunteers to come and help in any way that they can. So my biggest advice is, if you're interested in healthcare and you're interested in nursing, take advantage of that. Try and get a foot in the door at a facility to to volunteer to start getting that experience and start looking at different programs that in the areas that you may want to either stay in or go to, and get a head start in those opportunities.
That's great. Thank you so much.
Mhm.
I don't see any questions, so I think that's it. Did you have anything else you wanted to add?
No, I just want to thank you again for the opportunity to come and speak. If you all have any questions, I'll share my contact information, and please feel free to reach out with anything that you may need.
I think that's great. Thank you so much. We appreciate your talking with us today and giving us that information. Have a good day, everyone. Thank you.
Thank you. Bye-bye.